Hello, hello, everybody.
Hello,
Mitchell's
how are
dead
you
today.
doing? Yeah, it was a long day at work. You know how it is, trying to save the world.
Yeah.
Wait, what? Didn't say I'm a man in black.
Nope.
What are we talking about today?
We're talking about some Naplex prep when migraines is the first chapter today.
Okay,
So
welcome everybody. Welcome to Getting That Medical Degree, where we talk about medical related topics. Right now, we're doing a study session of Naplex since Zach here has recently graduated. So let's get into it.
get into it. So this is be for the migraines. This pretty much should be everything you need to know for the Naplex. This is done using some guidelines and also the RX prep book as the main source. So first of all is diagnosis of a migraine. What? So you need to have 5 attacks. So if I have migraine attacks, each of these need to last about 4 to 72 hours. That's a long time. I couldn't imagine having something for 72 hours. Could you?
Actually, I do because my girlfriend, she suffers from chronic migraines. She has a migraine every day.
Oof, that's not good. They should know about this topic a good bit then from her. So 5 attacks, each lasting at least 4 to 72 hours. It's also unilateral, which means just one part of the head. So not both sides, not just everywhere, just one little spot. And it's usually pulsating. So pulsating one spot. Also, people with migraines usually feel like nauseous and they feel like vomiting. That's what N means nausea. V means vomiting. This is my shorthand for stuff, and you see this a lot in textbooks as well. So I usually put them two together because they usually go well together. Photophobia, which means light, so light makes it worse. Or phonophobia, which means sound makes it worse. So 5 attacks, 4 to 72 hours, unilateral, pulsating. Photophobia and phonophobia are the main ones you're going to see diagnosis. So for non-prescription treatment, you can try caffeine aspirin or Tylenol can help. Butterbur and feverfew, a couple of like the herbal things you can use for it. Magnesium, riboflavin. They've been all shown to help prevent your migraines. So it's a couple of things to keep in mind if you don't want to go the prescription route first, since why use
So we also have coenzyme Q10. You probably heard about that one.
which one?
Um, coenzyme Q10. Also there are any anti-inflammatory in reality. So any foods that have anti-inflammatory. Also, you should avoid foods that um cause inflammation in the body.
Yeah.
So if you take turmeric, curcumin pills, or if you eat that on your diet, then that's also anti-inflammatory. The caffeine also exacerbates. Um, some people are able to have being okay with using caffeine, but other people like it just makes it worse down the line.
It depends. Everything depends person to person too. So caffeine might actually exacerbate yours, but typically caffeine and Tylenol usually help. So typically, but it can make yours worse in your case. So talking about the non-prescription stuff, what about prescription treatments? So you have medications called triptans or serotonin receptor agonists. There's like sumatriptan, rizatriptan, stuff like that. You have also ergotamines, which honestly I don't see these prescribed that much. I see triptans prescribed the most, at least in the pharmacy setting I'm in, which is community. Triptans are usually prescribed a lot. Opioids, butabitol, and tramadol are not recommended due to abuse. Butabitol is like a combination of like aspirin, caffeine, butabitol, and stuff like that. You see that sometimes used, and I'm pretty sure the data behind that's not too strong to actually work too well. And it can be abused as well, so it's not really recommended to do the abuse. I'm pretty sure its efficacy is not that good anyway, so why use it? So what are the triptans? So MOA means the mechanism of action. CI is contraindications when you don't use a drug. ADE means adverse drug events. So got those abbreviations out of the way. MOA is a 5-HT1 agonist. That's just a receptor name. Contraindication just means you don't use this medication under any circumstances. They have cardiovascular disease, uncontrolled hypertension, or ischemic heart disease. So the uncontrolled hypertension, you don't use it because this drug can actually increase their blood pressure even more, which is BP. Paresthesia and chest heaviness. Chest heaviness, I see a good bit people complain about, and then increased blood pressure. So make sure people watching their blood pressure, especially if they do have hypertension, make sure it doesn't make their hypertension become uncontrolled. Rizatriptan is also called Maxalt. Has an ODT form. ODT is like a oral disintegrating tablet, so you put it under your tongue, and it just like dissolves in the mouth. That's pretty important to know, because that one and Zomotriptan has an ODT. Sumatriptan, which is the one you see probably the most in practice, at least where I work at, that's called Imitrex. It has a sub-Q injection. Well, sub-Q has a spray, it also has an injection. Zomotriptan is Zomig. It is an ODT, oral disintegrating tablet, and also a nasal spray. So, and I think the spray up for Sumatriptan is nasal as well. Bromotriptan has the longest half-life. That's basically the only thing you really need to understand about bromotriptan is that it has the longest half-life. So, next up is the ergotamines. These are 3A4 inhibitors. That's just important because that interacts with a good bit of medications, which we'll go over in the drug interaction chapter eventually once we get to that point. A 3A4 inhibitor, you need to know that because that's just a stupid question. I might ask you, like, is this a 3A4 inhibitor, inducer, or some other receptor or CYP enzyme? CI, contraindications, life-threatening peripheral ischemia, uncontrolled hypertension again. If they're pregnant or prego, don't use it. Again, ischemic heart disease, don't use it as well. Now for the triptans, I forgot to mention, but you don't need to prime the triptans. So the triptans nasal spray, you don't need to prime it at all. But the ergotamines, you have to prime by 4 pumps. So you should do a pump, 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 pump. And you're basically doing it until the stuff actually comes out when you're spraying it. So prime by 4 pumps for ergotamines. The triptans don't prime at all. It should be ready. The drugs, dihydrogo ergotamine, or you also have something like ergotamine plus caffeine, which is called the brand name Cafragot. And this dihydroergotamine comes in an IM injection, so it's a intramuscular injection, sub-Q injection, or nasal form. Main thing to know about here is when not to use them. It's a 3A4 inhibitor, and that's really about it for these guys and how to prime them. Now next we have prophylaxis, so this is how you prevent it. So BB means beta blocker. So propranolol is the main one you see here because it does cross the blood-brain barrier. We also have metoprolol as well. So side effects of this is bronchospasms, bradycardia, so that means lowering your heart rate. Hypotension, so that's opposite of hypertension. Dizziness and impotence. Divalproex or VPA. It can cause fetal harm, hepatic failure, weight gain. So if you have a younger person who's worried about gaining weight, you probably don't want to put them on Divalproex. Usually they put them on propranolol. Also thrombocytopenia, increased ammonia in the body as well. Topiramate, fetal harm, metabolic acidosis, kidney stones, increase ammonia, open angle glaucoma, so glaucoma, not good. Weight loss. Also oligohydrosis. You know what that is by any chance?
No.
Reduces your sweating, so basically makes you not sweat. And that's a side effect from topiramate. That could scare a patient if they're not sweating. That's something to be aware of. A CGRP antagonist is a monthly injection, except the eptinezumab is about every 3 months. I don't see these guys too often, and that's why I didn't go in detail on these guys. You're mostly going to be worried about the propranolol, metoprolol for the prophylaxis. Neurotech is an ODT, which is 75 milligrams. This one's daily. Max dose is 75 milligrams every 24 hours. And you also can use Botox. You use Botox for chronic migraines only. This is for if they have over 15 migraines per month. So if nothing else is working, the doc might try to tell them, hey, do Botox for your migraine. So guys, if you have any questions about this topic, just leave them down below. I think I covered the main points on this, but if there might be maybe a detail or something you guys want to know more about, just let us know in the comment and we can go more detail about it. Anything we need to add, Mitchell?
No, you covered everything. I mean, this is your area of expertise.
Yeah, just wanted to see if you had any final thoughts before we end the video here.
Sounds like a very complicated test, but good luck to everybody.
Yeah,
All right,
good luck
guys, thank you so much for tuning in, and we'll see you next time.
next time. Peace.